Greetings, everyone. My name is Bradley, and I'll be your CPR instructor today. The first thing I'm going to go over with you today is going to be adult CPR. Now, what's considered adult would be 12 and up. And we're going to begin by going over our emergency action steps. Now, our emergency action steps are going to be check, call, and care in that order. Check, call, care. Now, what you're doing is you're checking your scene for safety. You got to make sure there's nothing around that can hurt or can harm you, such as power lines down, such as a wild animal in the area. Perhaps somebody injured this person. So we got to make sure the scene is safe before we approach an unconscious person. Once we have determined that the scene is safe, we're going to tap the unconscious person by tapping them. And this is an adult. Hey, are you okay? Are you all right? If the person is not responding, go move on to your second C, which is your call step. Identify someone and have them call 911, such as, hey, you in the green shirt, can you go call 911? This person is unconscious. Now you are ready to give care. But before we move on to our care step, I want to touch on a few things in the call step. If you are by yourself and no one else is around, you want to give 2 minutes worth of care for an infant, and the adult and the child. You want to call 911 before you begin CPR. Okay? If you are by yourself and no one else is around and you have a cell phone, you want to use your cell phone to call 911. Now you're ready to give care. All right. So first thing we're going to do, when a person goes unconscious, the tongue can roll back, blocking the airway. So we want to take and put 2 fingers under the bony part of the chin, one on the forehead, and raise up. That opens the airway, causing the tongue to roll forward. Now we check for signs of life for 10 seconds. In those 10 seconds, we're doing what is called look, listen, and feel for movement for those 10 seconds. Let me demonstrate. Your ear would be over the mouth, so you're feeling for breathing, you're listening for breaths. Your eyes should be looking at that chest cavity to see if it's rising and falling. And you're observing to see if you see anything that tell you that this person is alive. If there are no signs of life, your next step would be to check for a pulse. We check for a pulse in the group for the adult. This here is your carotid artery, and you'll be checking that pulse for 10 seconds. Okay, now if pulse, we would be doing what is called rescue breathing. Now in rescue breathing, we give 1 breath every 5 seconds for 2 minutes. That's 1 breath every 5 seconds for 2 minutes. So let's say I found the pulse on this adult, so I know I can do my rescue breathing. So of course I'll open the airway, pinch the nose shut, give my first breath, release the nose, and count to 5. 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000. Breath. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000. Breath. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000. Breath. Now let's say that's been about 2 minutes. 2 minutes, I'm going to recheck for the pulse. As long as there is still a pulse after every 2 minutes, you would continue rescue breathing. At any point, there is no longer a pulse that says that there is no more signs of life, so now I have to sustain life by doing CPR, and that would be the difference. So what you're going to do is lace your hands together, straighten your arms. Now CPR is 30 and 2, 30 and 2. That consists of 30 chest compressions to so you want to work, and you're going to get 2 and 3 and 7, 13, 6, 7, 8, 9, 2, 4, 5, 6, 7, 8, 9, 30. Then you want to open the airway, pinch the, then go back down and do the same. Come up, take a breath, and go right back to compressions. 30 and 2. PR, compression, 2 breaths. You are doing. Stop CPR would be number 1. EMS comes to relieve you. You can stop CPR. Number 2, the person revives or gain consciousness. You can stop CPR. Number 3, up on the scene. You can stop CPR. We do what is called AB, for circulation, airway, and breathing. So in other words, then you would open the airway and administer the 2 breaths. Bradley, and I was your CPR. Thank you for